hoping I get access to a video editor before you see this. If I don't, I wanted to start this video off with a scene of Coach Carr from Mean Girls talking about how if you have sex, you will get AIDS and die. That's kind of a joke and a nice way to softball in what I'm talking about today. I want to talk about HIV, the human immunodeficiency virus. So, some statistics on HIV. 1.2 million cases currently exist in the United States. 20% of those people who have HIV don't know they have it. Of the people who do know that they have it, only 78% are receiving ART, which is the treatment that slows the progression of the disease. HIV is a virus that infects the immune system, attaching itself to immune system cells called CD4 lymphocytes. Normally, these lymphocytes protect the body against viruses, bacteria, germs, and they leave the body vulnerable. It infects T lymphocytes, macrophages, and microglia. It's transmitted by blood products such as unclean needles, unscreened blood, having unprotected sex, vaginal, anal, or oral, and by mother to baby via pregnancy, labor, or nursing. A few symptoms, just to let y'all know what you would go through if you contracted HIV. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. People may experience abdominal pain swallowing, dry cough, fatigue, fever, loss of appetite, malaise, night sweats, nausea, vomiting, diarrhea, groin sores, severe unintentional weight loss, skin rash, or swollen lymph nodes. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS is acquired immunodeficiency syndrome. AIDS symptoms include weight loss, fever, and night sweats, much like HIV, fatigue, and recurring infections. It can eventually lead to death due to overwhelming infections with other microbes. No cure exists at this time. Strict adherence to antiretroviral therapy can dramatically slow the disease's progress, prevent secondary infections and complications, and it can also prolong your life. There's a lot of ways to prevent HIV. Abstinence is the only 100% effective way to prevent contracting HIV. While not 100% effective, it is most effective to use condoms to prevent HIV when having sex. Getting tested and making sure your partner gets tested regularly can also help. Monogamy and limiting your number of sexual partners, pre-exposure prophylaxis or PrEP also lower the risk of contracting HIV. You can get HIV tests at your healthcare provider's office, sexual health clinics, local health department, family planning clinics, VA medical centers, and substance abuse centers. The CDC recommends everyone between the ages of 13 and 64 get tested at least once as part of your health care routine. Those with specific risk factors should also get tested at least once per year.